Hi, everybody. Today I thought I'd like to talk to you about the different types of facelifts that you may be considering. Um, today, as we're all living longer and working longer, the desire to maintain our youthfulness is very popular and more acceptable. However, surgical procedure, a floor facelift or a face and neck lift to maintain your youth is still met with a lot of trepidation by most people, just because surgery is still a scary prospect, not to mention the financial costs and the downtime involved. Surgery also carries anesthesia risk, which is a very common fear of people looking for surgery. However, many patients we're seeing come to our practice is actually looking for a surgical procedure to facelift because they want that more effective natural result that lasts about 8 to 10 years. And we've had many patients also tell me that in their decision making that doing fillers and threads and energy-based devices each year can be expensive as well. And then you have to do this every year, every 2 years. And in their mind, they made the calculation that while a lower facelift is more expensive up front, um, it's actually more cost effective because that procedure will last them 8 to 10 years versus going back every year for threads and fillers. So when you research, you may be confused by all the terms that are out there on the internet, such as I've seen the Y lift or the S lift. There's the Max lift, MACS. Another very popular term you may have run across is the deep plane facelift. And so it can be confusing because there seems to be so many choices. In my opinion, many of these terms are just sort of clever marketing ploys to try to describe a minor tweak to the basic procedure of the facelift, and then they can market it and makes their practice look unique. But in my opinion, there's really one key issue, and that is what is done to the SMOS, or the superficial musculoaponeurotic system. That's that muscle that's underneath your skin, that's here, and is contiguous with your platysma in the neck. So what the surgeon does to that layer is key to understanding what that facelift, what that type of facelift is advertised. So in my view, there's really three main things you can do to the SMOS. You can either just plicate it, which means you just take the SMOS and you just pull it onto itself and tie it in with the strong suture. So you're basically pulling that muscle up to where you want it and then just suture, plicate that. And that can give good results in select patients. The second variation or question is what is if you cut it, called imbricating. So if you imbricate it, it's basically taking that muscle and you're actually cutting out the excess tissue that you measure, and then there's going to leave a gap of SMOS, and then you pull that up, and that gives you the result you're looking for. And then the last issue or the last type is if you undermine that SMOS and free it up and then pull it up and then either imbricate or plicate it, that's probably the more strong and more robust procedure. And that's where probably the deep plane facelift term comes in. So to summarize, there's three main things you can do to SMOS. You can either plicate it, just pull it up and suture it. You can imbricate it or just cut it out, whatever excess the surgeon measures, and then pull that up and then suture it. Or you can do deep plane or extended SMOSplasty. There's really, I think, two main things with that third technique, which is what do you do with that SMOS? You have to elevate that SMOS with the platysma and then reposition that and either secure or cut out excess SMOS. And that third technique is what most, I think, kind of modern or more surgeons today use. And that's also where the deep plane facelift is. So the deep plane facelift is basically you elevate the skin and then you make an incision on the SMOS from your lateral canthus, alternate angle mandible. Then you elevate that SMOS layer and then you pull that up to the desired effect. What I prefer to do is called the extended SMOSplasty or a high SMOSplasty, where actually I'm cutting the SMOS this way and then down and then elevating that whole flap. So again, both the deep plane and the extended SMOSplasty are elevating that SMOS versus the imbrication and plication where you're just sort of pulling it up and cutting out, etc. I think the third technique just provides the most robust kind of comprehensive rejuvenation of the face and the neck. So when you see your surgeon for consultation and you're asking about how they do their facelift. Just sort of had that in mind, and hopefully that will help you. I will also say that one very important thing that I think is important to tell people is that there is no one right answer. So, in other words, plication is not better than imbrication. In addition, a deep plane facelift, which is a very popular term, doesn't mean that's the best technique. So, I would sort of disagree with anyone who says that the deep plane is the gold standard or the best technique, because at the end of the day, this is a surgical procedure which is based on technical skills and science, but also on the artistry and experience of the surgeon. And like when any artists, you can achieve great results with different techniques, different paint brushes, etc. So at the end of the day, I think the more important question is you have to find a surgeon that you trust, that is board certified, has good results, and that you feel like will have your best interests in mind.